Thank you all. It's always great to be here and see new faces and med students and see the energy that is coming to the movement of direct care. The title of the conference is Thrive, Not Just Survive, and it's exciting to see that's how direct primary care is helping doctors. So for the ones not familiar, we did start our practice September 2nd, 2010, straight out of residency, 0 patients and 1 doctor. And the idea, again, that just insurance isn't bad, but it wasn't helping. It's a tool, and we want to make sure that we use that tool correctly. You don't have car insurance for gasoline, life insurance for groceries. So why fundamentally are we using health insurance for outpatient care, family medicine, internal medicine, pediatrics? And so what we said is, let's develop a better system. And as we worked through the process, we saw that there were lots of options. I'd been watching concierge medicine since 2000 when I was an undergrad. And it started off, of course, the high price model that was probably not a doable model for most patients or most doctors. They just didn't see themselves fitting into that piece of the system. But like most innovation, it starts off expensive and gets cheap. I was reading some fun technology stats the other day, and in the 50 years since Moore created Moore's law about the speed of technology will double every 18 months, we've had a trillion-fold increase in processing speed. And in fact, a 1985 supercomputer is roughly equivalent to an iPhone 4. Which basically means we're all walking around with supercomputers in our pocket, and it's affordable. So in an analogous way, it had to start off maybe on one end that was expensive, but now the model has worked itself out so that it's applicable to the masses. And that means doctors and patients, that we can all take care of the populations around us in a meaningful way. So we built our model, just to summarize it real quick. Again, membership, because that simplifies a lot of things, but $10 for kids, $50 for most adults per month for unlimited home visits, work visits, office visits, and technology visits. So that includes text messages, emails, cell phones, Skype, FaceTime, etc. No copays for anything in our office, because really that's what the membership is for. And the whole goal here is kind of like Costco. You have your membership once, and they keep building value into that to protect and support the reason the customer buys the membership. So no copays. And then any procedure we can do in the office is included free of charge. Because again, add value to that membership. Make it easy for the consumer to say that this is a better version of what they were getting somewhere else and is more cost effective. So stitches, biopsies, joint injections, ultrasounds, DEXA, spirometries, Holters, cryotherapy, rapid streps, urinalysis, lesion removal, toenails, etc. All free because it doesn't cost enough for me to worry about that. EKG pads are 3.5 cents. Cryotherapy essentially $0. Rapid streps $1. Every industry has these little fees, and they'd rather absorb it in than try to nickel and dime their customer. So you can take that financial algorithm out of it, so the patient doesn't worry about what it'll cost when they come in and their chest hurts and they want an EKG. They don't have to, and you don't, as a physician, have to worry about tracking that. Do they have their copay? Do they not have their copay? Did I charge? Did they pay? Etc. So there's a great book, Exponential Companies, and it talks about some of the most successful new companies of our time have this rapid growth for key reasons. They simplify business models, they innovate, they have a culture of wow, adding so much value that it's a no-brainer. Their customer easily adopts this over the status quo. A great example of this is Netflix to Blockbuster. Every Blockbuster I know is turned into an urgent care. Because their model was wrong. It got outdated. And Netflix, which actually started, I think, in 1998, which means it's like 15 years old, which is odd, it is able to offer 10,000 movies and 3 seasons of House of Cards to me for $7.99 a month. Versus Blockbuster, I may pay $7 or $8 once a month to go there, and I rarely went once a month because they never had what I wanted. Analogous to that, if we create a better system and offer even more value to our patients, if you build it, they will come. Uber to taxis. I prefer not to take a taxi. I love taking Uber because it's so simple. And doctors, I think, really struggle with this idea of innovating in the space of business, because for so long we had this idea that you couldn't do both. You couldn't be a good businessman and really take your oath seriously, care about patients, whether that was self-imposed or profession-imposed. But we take a very bold stance now to say that really embracing and holding true to our oath of do no harm must mean do no financial harm. We must continually push ourselves to find ways to innovate that brings value to our patients. A great example to further explain our business model, we do wholesale medications, labs, imaging, pathology, etc. So most of the time medications are 90 to 95% off. I get 1,000 Lasix for $8.33. It used to be $8.97, but the bigger we get, the better our discount is. So, I mean, I can just literally, it's 10 times cheaper to use us than it is Walmart. And that's just one piece. But you take Imitrex that, go to goodrx.com and price check it, and in our area it's anywhere from $88 to $256 for generic Imitrex. And our wholesale price is $6. Our patient pays $6. So how long did doctors struggle with patients who couldn't afford their medications only because we complained about the system rather than finding a way to fix it ourselves? So how many low SES patients could have been employable because they had their migraines controlled, or just have more money in their pocket? You don't have to be rich to like more money, but if you're poor or you're working a low-paying job, that is huge. That savings is even more significant because, as a percentage-wise, that's days back in your pocket. That's time back with your family, not to mention the quality of life. One ER visit avoided because I can give you a shot of Toradol for $1.50 in my office versus the ER saves you the cost of the membership for the year. So if doctors push themselves to say that direct primary care now removes all these hurdles, I really do think we had a culture of either learned helplessness or groupthink. There wasn't a culture of innovate and help and build because we always felt that that wall was built by insurance and government. If they didn't pay for it, then by default we couldn't really do it. And we're so busy seeing 30, 40, 50 people a day that we focus more on the task at hand than the future ability to practice. So direct care is so fantastic, and I think really my new social media hashtag is Slow Tsunami. As doctors hear about it, as patients, employers hear, they say, yes, this sounds great. Why aren't more people doing it? Well, when we started, less than 1% of doctors were doing it. And they still said it wouldn't work. Doctors say, we aren't the best business people, so we don't have the best vision in that regard. But now 15, 20, 30% of doctors are converting to this model. The American Academy of Family Physicians is seeing a huge increase in the number of doctors interested in this model. These conferences continue to grow. We hear about it all the time. So because it's a better value for the doctor and the patients alike. But that means that we have to keep innovating and keep finding ways to help our patients. The really interesting thing about that, though, is we are the leaders of this, and maybe we've forgotten in the process. Insurance wasn't bad because of anything in particular. They were doing exactly what we asked them to do, which was take my money and pay for my health care. So they made the healthcare decisions. When you take the money back, you get to make the decisions yourself. And so what we're doing by our full value proposition with our model, then we can go to an employer, especially a self-funded employer, and decrease their insurance costs by 30 to 60% year one. We have employers who have been with us 4 years who pay less in insurance every single year going forward. If we did that for even 10% of the employers in your area, there'd be an economic boom. So, and I think in large part because we didn't come at this with a voice of antagonism to insurance, but really one of synergy. How do we work together? I may not be happy with what insurance has done in the past, but at the same time, I know my patients need it. So how do we show them how to reinvent their model? How do you make insurance cheaper? Use less of it, right? Insure fewer things. Now we don't insure gasoline and oils and tire changes. And we don't need to insure a CBC that cost me $2. An A1C that cost me $2.71, and that's with my 10% markup. So, now insurance can carve out all those things, get back to covering the catastrophic stuff that they're intended for, which means lower premiums, more jobs, happier patients. And we can keep pushing in that direction, and if we all are doing that, and we're all innovating at that speed, then the patient ultimately wins. Henry Ford has a great quote. Basically, it says, if A plus B equals C and C is profit, the only thing you have to focus on is A plus B, because that C, profit, is the natural result of doing A and B really well. So as long as we continue to focus on our patients and provide them great service at a great price, the rest will fall right into place. And that's the exciting part, and we've seen this grow now. We constantly are consulting with doctors and helping them start their practices, and we have a whole startup packet that we offer to doctors free of charge, and I have that if anybody would like it. But as employers and patients and students and everyone sees this, it's growing so much quicker than Dr. Bryan's numbers of the medical home, because the medical home is putting a square peg in a round hole, like he was saying. It wasn't working, and so it's not growing, versus direct care is taking off because it makes sense. So, thank you.